Stereotyping and aging. A stereotype is a type of social knowledge structure that represents shared beliefs about characteristics and behaviors of a particular social group. Stereotypes can affect how information is processed in our brains during different social interactions. Despite popular belief, stereotypes are not always negative, but oftentimes the connotation can come across this way. Ageism is a set of beliefs, attitudes, social institutions, and acts that denigrate individuals or groups based on their chronological age. These beliefs lead to unfavorable treatment toward older individuals. This can also affect both the young and the old. However, for the sake of this presentation, we will be focusing on the effects that stereotyping has on older individuals. Most stereotypes directed at older individuals have to do with personality traits and perceptions of competence. This affects how capable we see adults as when performing certain tasks. Stereotypes are spontaneously activated because they are overlearned when we meet numerous individuals that fit into a specific group. This activation of strong stereotypes that are automatic and unconscious is known as implicit stereotyping. This type of stereotyping heavily influences our behavior without even realizing it. There are many stereotypes that exist involving age, the ones listed below being some of the more common ones. 1. Older people are helpless. They can be vulnerable during certain situations, but this definitely doesn't make them completely helpless. 2. Older people will all eventually become senile. Some memory loss does take place through aging, and the risk of developing dementia does increase with age, but these dementia-like symptoms are not part of normal primary aging. 3. Older women have less value than younger women. A woman's worth is commonly related to their beauty, caregiving abilities, and youth, which is why this worth diminishes as women age, but many older women still possess these qualities even in their older age. These ageist beliefs and stereotypes can have serious effects on the health of older individuals. Negative attitudes can cause adults to live 7.5 years less than those with a more positive outlook on life. These negative attitudes can be a result of being a victim of ageism and beginning to believe the many stereotypes that are heard. Common stereotypes may cause older individuals to be misdiagnosed or not diagnosed at all. For example, since there is a common belief that all elderly people go senile at one point or another, this may prevent doctors from diagnosing the individual with dementia if they feel that the symptoms are normal symptoms of aging. Ageism can become self-fulfilling when the person begins to use these common stereotypes to their advantage, which can then result in social isolation, physical and cognitive decline, lack of physical activity, and economic burden.